This video will serve as an introduction to the APGAR scoring system, which is a quick, easy evaluation of a neonate or a baby that has just been born, so as to clue in as to how that neonate is doing health-wise and how they will progress from that point on. The APGAR scoring system, or the APGAR scale, was developed in 1952 by a female anesthesiologist named Virginia APGAR. Now, although this scoring system is named after Dr. APGAR, APGAR also serves as the acronym by which we can easily remember the 5 aspects of the scoring system. We're going to go through those 5 aspects now. The first of which, A, stands for appearance. Now, as you can see on this sheet, all 5 elements of the APGAR scoring system are rated on a 0, 1, or 2 numerical scoring system. The 2 is the best on each element, and the 0 would be the score that has the worst prognosis. So for appearance, while looking at this neonate, if the neonate appears blue or pale throughout, that would be a score of 0 for the appearance element. Acrocyanosis, which is where the neonate has pink centrally or on their trunk and head, but blue peripherally on the 4 extremities, so on their hands and feet they're blue, but on their trunk they're pink. That's called acrocyanosis, and that's awarded a score of 1. Now, if the neonate is pink throughout on their hands, feet, trunk, and head, which is what we want to see, they're awarded a score of 2 for appearance. The next element on the APGAR scoring system starts with a P, like the second letter in APGAR, and that's about the pulse or heart rate of the neonate. 0 is when there is no heartbeat. The heart rate is absent. The neonate's heart is not currently beating. A score of 1 is awarded if the heartbeat is less than 100 beats per minute, and a score of 2 is awarded if the heart rate is greater than 100 beats per minute. So, if we had a neonate that had acrocyanosis and a heart rate of greater than 100, so far we would have an APGAR score of 3, because we'd have 1 for acrocyanosis and 2 for a heart rate greater than 100. The third element is going to start with the G, like the third letter in APGAR, and that stands for grimace. 0 is if the baby's face is making no sort of facial expression or grimace. A 1 is awarded if the baby or the neonate has a feeble or weak cry, and a 2 is awarded if the baby has a strong cry. You're going to notice with all these elements, or most of these elements, that a 0 is when the element is absent or not there, so an absent grimace, an absent heart rate. And a 2 is what's normal, or what we want. So think about the heart rate. Well, we want a heart rate greater than 100, so that's going to be a 2 for pulse. We want a strong cry in our neonates, so that's going to be a 2 for grimace. So one easy way to remember what is scored as a 0, 1, or 2 for each of these elements is that a 0 is going to be absent, a 2 is going to be normal, or what we want, and a 1 is going to be somewhere in the middle. So not absent, not strong, but feeble or weak. And that's the same for heart rate, that's the same for grimace, and that's the same for a lot of these different elements. The fourth element, which is the second A, stands for activity. Here we go again with the 0 being awarded if there's no activity. The baby is lifeless or not moving. A 1 is awarded if there's some flexion or some weak movement, and a 2 is the normal full range of movement. All 4 extremities are actively flexing. The last element, which is an R, stands for respirations. Here again, 0 is awarded if there's no respirations, if the neonate is not breathing. A 2 is awarded if there's strong respiratory effort, meaning the baby's actively trying to breathe. And a 1, that middle range, that gray area, is awarded if there's weak respirations, or the baby is trying to breathe but not as strong as we'd like to see. Now, why do we care about this 0 through 10 scoring system? Well, because when you have a neonate who's just been born, we've learned over the years since 1952 that it's important to take APGAR scores at 1 minute and 5 minutes after birth, and we can then take it later on as needed. So some obstetricians will take it at 15 minutes, some at 30, especially if these first 2 scores haven't been that great. We'll take it again at different intervals to see how the baby is progressing after being out of the uterus. That first 1 minute interval, it's more of a clue. And what we like to see is the high numbers. So 7 through 8, 9, 10. If we see those numbers here, everyone in the room kind of breathes easily and kind of relaxes. We know that the baby's kind of out of the woods and it's going to do well. The 5 minute interval is really the one that kind of dictates whether there's going to be permanent damage to this baby because it hasn't evolved well to an out of utero experience. And so what we're looking for at this 5 minute is kind of like we said, those high numbers, greater than 7. That's normal, that's healthy, and we're looking good there. If you start to see less than 3, that's where you start thinking about cerebral palsy and neurological damage, that baby's not getting enough oxygen into its tissues, and you really start to worry. You're going to need immediate critical care, immediate NICU care. And in between that 3 and that 7 is a gray area. 4 through 6, you're going to need care. You're going to need, that baby's going to need attention, but it's not necessarily, doesn't necessarily mean that they're going to have permanent neurological damage. And this is, if you had that 4 through 6, that's where you're going to take sequential APGAR scores at 15 and 30 minutes to see how, after your immediate attention, how that baby is progressing. So again, you have your 5 elements, each 0 through 2, add up their scores at 1 minute, 5 minutes, and again as needed to give you a 0 through 10 score. You want to see a score, you love those 8s, 9s, and 10s. Some obstetricians, some pediatricians will tell you never give a score of 10. You can always find something wrong or something that could be better with the baby, and that it's bad luck to award a 10. I'm of a different opinion and love to see anything above a 7, especially a 9 or a 10. And that is an introduction to the APGAR scoring system.